The Comfort Cub idea came to me after I lost my son. My little boy George died the day he was born, and along with the obvious emotional pain you'd have of losing a child, I got some surprising physical symptoms. My heart literally ached and my arms ached, and I had no idea why that was happening. So when you get a weighted object in your arms, it actually does something chemically in your brain that causes your neurotransmitters to fire in your brain, and it sends out dopamine and serotonin, which are the happy hormones, and that helps you to feel much more calm. It allows your breathing to slow down, it allows your heart rate to slow down, and you get an overwhelming feeling of wellness and calm. In the last 6 years, they've just given it a clinical diagnosis, and it's called takotsubo syndrome.
Broken heart syndrome, or takotsubo syndrome, it has a lot of different names. One of the medical terms is stress-induced cardiomyopathy. And what happens in this syndrome is the patient's heart, the tip of it, or the apex as we call it, balloons out, whereas the base, or the bottom part, is beating normally. The studies vary on what's the most common trigger, but certainly I think in my experience, the most common trigger is a, quote, broken heart, a sudden loss of a loved one. Far and away, in the cases I've seen, that's the most common trigger. And they experience symptoms and signs that for all intents and purposes mimic a real heart attack, including the electrocardiogram and including the blood tests that we use to diagnose a heart attack. Someone who's experiencing takotsubo syndrome is probably having a surge of adrenaline in their body. We believe that's what causes this. So anything that can help lessen that adrenaline and cause the release of counter hormones like dopamine and good things could potentially be therapeutic. And I can see how having a weighted object to lift and hold close, especially as a mom, might be able to elicit an emotional response that could have real therapeutic value.